Hi, I'm trying to force a smile out for you. Well, I guess everybody's curious by now to learn how I made it, or if I made it through a very intense major surgery. I was going to show you pictures of it, but I mean drawings, imprints of it, I should say, not an MRI, but a picture of the actual artificial joint and the rod that goes down into the femur bone and the ball that places into the new joint. But of course I forgot to bring them here in bed, and I certainly can't get out right now. This is day 10 after the surgery. If you're interested in watching an actual joint replacement for a hip, do go on YouTube and get an actual medical site. Do not get a cartoon or an animated picture. Get a medical site and study it for yourself. It's very, very intense. However, they have it so perfected now that what used to take 3 hours only took about an hour and 15 minutes for mine on the 16th of April. The actual procedure itself, as far as I could tell, was painless because I was given Versed and Propofol, and of course I had a spinal from my lower chest area down to the tips of my toes. So I was completely dead. I felt nothing, and also when they give you Propofol and Versed, you are put in a state of amnesia, so you don't remember anything about the procedure. The pre-surgical day went really good. God answered every prayer I had prayed in the name of the Lord Jesus Christ. I had absolutely no anxious moments. I was completely relaxed. My son and I went down the evening before surgery and stayed in a motel because mine was the first surgery. I had to be in the pre-operating room at 5:30 a.m. So we rolled in there and got admitted, got into pre-op, and the nurse set the PICC line in my arm. Had no problem at all with that, even though my veins are very hard to find. They didn't sedate me with anything, and then the anesthesiologist came in and conferred with me, and she said that she noticed I had that I had acid reflux upon occasion, and she said, we don't want to do a spinal if you're having acid reflux. We would prefer to do general anesthesia so we can put the airway in. She said the advantage to doing a spinal is you won't have us put the tube down, you won't have an artificial airway. And I said, well, I sure hope I can have the spinal then. And I had prayed really hard, and God answered that prayer. So I was able to have the spinal without the artificial airway, which of course eliminated the sore throat after surgery. When they removed me from the pre-operating room, they had given me a little touch of Versed, just enough to take the edge off. But I remember going into the operating room and seeing the huge room with the L-shaped tables where my medical theater, my surgical theater, was placed in, and there were 5 surgeons standing at the various tables. I was lifted off of the gurney onto a very hard, it felt like marble. It was just, it was like iron. It was like an iron table, and they have to have that table solid so the body does not move 1 little millimeter, because if the body moved even a slight milliliter when they are cutting it or opening or removing fat or tissue, it could cause a disaster. So that table's really hard. And then the anesthesiologist came in and she said, okay, Linda, we're going to ask you to set up. And I sat on the table, and in front of me was a gentleman with a pillow, and I was told if I needed to, I could press into the pillow. She said, okay, you're going to feel like a bee sting in your spine, and then you're going to feel another sting, and I did. And the next thing I knew, I was in the recovery room. It was all over. Bang. Yeah, an hour and 15 minutes. Wasn't aware of anything. In the recovery room, I looked around. There were about, 6 other patients, I guess. One nurse was attending me and the patient next door. I was totally dead. It took about an hour for my legs to unnumb from the spinal. And pretty soon the nurse came around and she said, "Can you wiggle your toes?" And I said, "Yeah." And I said, "And I'm starting to feel the pain." And she said, "Well, just let us know when you get up to about a 6 and we're going to give you some fentanyl." Well, when I had been, a year ago when I had conferred with the surgeons at Providence Hospital, they told me they don't use fentanyl. They're not even licensed to use it. They don't like to use Dilaudid or morphine, but in Overlake, under Dr. Breckland, they use whatever you need. They have the whole gamut available for post-surgical pain. So I was given some fentanyl, and it took the edge off a little bit. And then she said, "Well, would you like some Dilaudid or morphine if you're not getting down to about a 3 on the pain scale?" And I said, "No." I said, "I'm all right if you just get me up to my room. I think once we get on the regular pain med pattern of just the oral medication," I said, "I'll be okay. I can handle it." Well, I'll tell you why I could handle it. This whole thing was strictly done through and by the love and the grace, mercy, and power of my Savior, the Lord Jesus Christ. I am basically a kind of a cowardly person. I'm kind of scared to death of even an antibiotic shot. And here I am having my old hip sawed off, drilled out, and a new hip hammered in. And it's a gross, very intense surgery. A lot of blood, a lot of bone is sawed off, and prostheses put in. I'm going to tell you, the recovery's painful. The worst part of this whole ordeal was not the surgery, it was not the day after. I was up and walking within 7 hours of the surgery. I was walking in my room. The nurses were very impressed. I was able to go home the following afternoon at dismissed me about 4 o'clock. I want to tell people out there, if you need a bone replacement for your knees or your hips, please just do it. You know, I put mine off because I was a coward. I was afraid to have it done. And then when I put my last YouTube on, remember that one I gave a couple scriptures on the days of darkness, and of course I had a lot of opposition, but I also had a lot of people saying, "Thank you, beautiful lady, we're praying for you, you have our prayers." And I tell you, friends out there, I tell you with my heart, I felt your prayers. Your prayers for me were so real. The power of your prayers was so real that I felt the love and the nearness of my Savior Jesus Christ, the great physician. He was with me every inch of the way. And I want to thank you from the bottom of my heart. Because I had not one bit of nervousness, was not afraid at all. And it was awesome. I've never experienced anything that, oh my, what's the word, out of this world wonderful, ever. So I would say that, yeah, that day and the day before and the day after, it was wonderful. It was actually wonderful. I enjoyed it. It was like, yay, God, you came on the scene again. When we need him, he's there. When we need Jesus, if we call in faith believing, he's there. Okay, but I will tell you, the other side of it is, make no mistake, when you watch these YouTubes and patients pretend, well, maybe they are real patients, but they'll do a YouTube and it'll be like well, I saw one here about a month ago. This guy said it was on day 8 after his hip transplant, and he says, I'm day 8 after surgery. He was using a cane. He was walking his dog in the meadow. And I looked at that and I said, either you're lying or you're embellishing your story or you're just plain crazy, because there is no way on day 8 you're going to get up and walk a dog in a meadow on a cane. I'm a strong woman. I'm 77, but I might be a little fearful sometimes, but I am a tough cookie. And if I can't get out in the meadow and walk a dog on day 8, I don't think many other people could. It is a painful, painful recovery. The surgery itself is wonderful, but the recovery is very painful. Now, it's nothing that can't be managed with proper pain management. You'll do fine. Don't be a coward and stay away from joint replacement because you're worried about the pain. They have so many ways to help us nowadays. So please, just have it done. If you have bad knees or bad hip, just do it. Get it over with. Yeah, you'll hurt for about 4 weeks. I'm not able to bend over. We can't bend. I had a posterior incision, so I can't bend any further than a 90-degree angle, which means I can't even go to get stuff out of the bottom part of my refrigerator. But I can't make a bed. I can't pick up anything off of the floor. And I'll tell you, I'm going to be real honest with you people. This is why I wanted to make this video. I believe in honesty. I believe in be gut level honest with people out there, because I'm here today in my hospital bed to tell you things that are going to help you. When you have this surgery, please line up help beforehand. I was so blessed. I had 4 children to help me and my caregiver. One of my daughters stayed the first 4 nights. The other daughter stayed the next 3 nights. My youngest son stayed for 2 nights, and my eldest son will stay with me tonight along with his wife. My caregiver came in yesterday and gave me my first shower on day 9, which was wonderful. I felt so good having that shower. Now here's another thing. You're going to need help to get up and down, especially the first 4 or 5 days. Today I'm able to do it on my own, but it's a stretch, but I can do it. Night times are the worst. In the middle of the night, you'll be sound asleep, and all of a sudden the pain will hit, and you'll be wide awake, and you'll be going like, I think I could use a little medication. That's normal. Don't be afraid to use your meds as prescribed. And I mean as prescribed. Do not take advantage of your medication. Use it properly according to doctor's orders. But on the other hand, don't be afraid to use them, because you'll need help. Now another thing, please listen to me carefully, that you will probably need help with. Some people don't. I did talk to a lady that had no problem at all, and that's going to the bathroom. Not only is it important to keep your bowels open so you don't get constipated, because trust me, you don't want to get constipated. You take your laxative and your Miralax, Metamucil, X-Lax, Senna, whatever you take, and you keep bowels open. But the other problem is cleanliness, wiping after a BM. Yes, that is hard, because you cannot bend in to the side where you had the surgery. And even if you bend into the other side, your arms and your hands generally are not going to reach all the way around to that area. And you certainly don't want to reach, like a lot of women do, reach underneath and clean the perianal area. There is no way you do that, because you'll pop that ball right out of the joint. So do not bend forward. Do not break that 90-degree angle, or you will be back in surgery, going through surgery number 2, getting that ball put back in your joint. And that's a hellish thing to go through. So just pay attention. Okay. Your appetite will come back in a day. You'll be as hungry as ever. You're going to be sleepy. Your sleep will be very much interrupted. I don't think I've gotten a decent night's sleep. Well, I haven't. I have not had a decent night's sleep for actually for weeks before the surgery because my pain was at such a terrible level. But the last 10 nights, it's been interrupted at least twice a night when the pain has woken me. So don't expect to get a full night's sleep, but you can take naps during the day. Okay, what else can I tell you by way of encouragement? Exercise is very important. They will want you to line up with physical therapy, but meanwhile, you'll be sent home with exercises to do in your bed, exercises, and then with your walker. You will get out of your bed and you'll stand holding your walker and you will lift your leg, you'll slide it side to side. You'll have about 12 different types of exercises to do in your home, and you do them. Because the more you walk and the more you move that joint and all that cut tissue, because they've macerated you pretty well in there. And you've got to keep movement going to keep the blood flow and the oxygen going and to keep all the healing modalities going so that the tissue and the muscle, the ligaments and tendons can take a hold of those artificial joints and heal over the artificial joints. You've got to keep movement going, but don't overdo it. Because if you overdo it, you're going to be quadruple amount of pain the next day, and that is counterproductive. So use your common sense, okay? Well, people, I guess that's about all. I just want to... Could you hang on a second? Oh, you do get dry. You get dry. My last video, when I asked you to pray for me, like I said, I felt your prayers so strong, and I just want to thank you with all my heart. It was awesome. It was awesome. Please, if any of you need this surgery, buck up, be brave, and do it. If a 77-year-old lady can go through this intense of an amazingly difficult surgery, anybody can do it. You can do it. So just do it. We can get through the recovery because we can do all things through Christ who strengthens us. And in our weakness is His strength made perfect. And that's what gets us through this, is the strength, the love, mercy, and grace of our Lord Jesus Christ. Thank you for listening. God bless you. And when I get to feeling a little better, I'll be back with some new little tidbits that the Lord has given to me. And meanwhile, I can't even sit at my computer yet. So this thing is sitting up in my bed. I'm laying in my hospital bed. But one of these days, I'll be back at the computer. Okay, guys, I'm going to flip this around. And I'm going to show you my kitty picture.